AHRQ Safety Program for Long-Term Care, HAI's CAUTI Long-Term Care Safety Toolkit. Module 1. Using the Comprehensive Long-Term Care Safety Toolkit, Applying Safety Principles. The Comprehensive LTC Safety Toolkit assists users with how to apply safety principles. This overview module explains the purpose of this toolkit and how it can be used in your facility's quality improvement initiatives. The objectives of this module are to describe the purpose of the LTC Safety Toolkit, explain how the LTC Safety Toolkit supports other quality and safety tools, and demonstrate how to apply the LTC Safety Toolkit in your facility. The purpose of this toolkit is to support learning and implementation efforts to improve safety culture in long-term care or LTC facilities. Safety concepts including senior leadership engagement, staff empowerment, teamwork and communication, resident and family engagement, and sustainability are addressed. These tools are used in combination with clinical or operational efforts to minimize harms such as falls, medication errors, and healthcare-associated infections such as catheter-associated urinary tract infections. The toolkit provides tools that are not meant to be an additional program or effort done at your facility. These tools supplement other quality and performance improvement initiatives, all of which aim to change the way facilities do their work and provide care, allowing for better outcomes and higher quality of care for residents. Why is infection prevention and quality improvement important? Think about why they are important in your own facility as you watch this video.
I want to thank everyone for being here. We're all very busy, so it's beneficial when we can be in one place at the same time.
Thanks.
Glad to be here.
I'm excited about our meeting today. This is our first meeting to talk about a new program we're launching to help reduce healthcare-associated infections, or HAIs, in our facility. Helen does a great job, but this isn't something that can be done by her alone. We all have a part to play in preventing these types of infections. We all know that HAIs are a major problem in nursing homes. We've had a few cases of urinary tract infections, or UTIs, with resistant organisms in residents with catheters. And one resident developed a C. diff infection after receiving antibiotics to treat her UTI. Many of our residents are at increased risk for infection from these organisms due to their weakened immune systems. So we all need to do everything we can to develop a workable plan to protect them.
Well, C. diff spores can survive on surfaces for months, and they're highly contagious. C. diff infections most often occur when people are taking or have just finished taking antibiotics. So to solve these problems, we need to use antibiotics only when necessary and work on infection control to prevent transmission of C. diff.
I've been with this team for 5 years, and I can still remember a couple of our residents who got C. diff infections during antibiotic treatment for UTIs. So I understand this is a serious issue.
Why is this work important? There are a few questions that put the issue of resident safety in real terms. Think about the facility where you work. Would you want a loved one to be a resident there? Would you want to be a resident there? Does your facility do everything it can to protect residents? How do you think the next resident could be harmed in your facility? Do you feel comfortable talking about resident safety in your facility? Why or why not? When a safety issue occurs in your facility, how does your facility address it? Is there a formal process to track safety-related improvements? Do you believe this process is effective? The LTC Safety Toolkit presents the cultural interventions that supplement the technical interventions needed to reduce healthcare-associated infections. These cultural interventions can be summarized with the TEAMS bundle. Team formation to plan and implement the program. Excellent communication skills learned. Assess what's working and plan to expand. Meet monthly to learn together. And sustain efforts and celebrate success. These 5 concepts will be covered in the 6 LTC Safety Toolkit modules. The 6 modules are Using the comprehensive LTC Safety Toolkit, Senior Leadership Engagement, Staff Empowerment, Teamwork and Communication, Resident and Family Engagement, and Sustainability. After a facility's first implementation of the LTC Safety Toolkit, modules can be used in any order depending on the needs of the facility. They are intended to be standalone educational sessions and can be used in conjunction with other quality improvement tools your facility is using. The toolkit provides educational support for staff interested in improving safety and quality. The PowerPoint presentations, facilitator notes, and videos are ready-to-use content. Each module can be shown in its entirety, or they can be broken into smaller portions depending on the length of the educational opportunity and the needs of the facility. The materials are aimed at both senior leaders and frontline caregivers in the LTC setting. These frontline caregivers include, but are not limited to, certified nursing aides, licensed practical nurses, registered nurses, nurse managers, and infection preventionists. In the Senior Leader Engagement module, we will identify characteristics of successful quality improvement or safety leaders, list 5 practices of effective leaders, describe the responsibilities of senior leaders, explain the role of the senior leader in addressing clinical, operational, or safety efforts, and describe how to engage senior leadership in the facility's initiatives and develop shared accountability for the work needed to achieve the facility's safety goals. In the Staff Empowerment module, we will understand staff empowerment concepts, discuss the importance of staff empowerment to create a culture of safety which leads to improved outcomes and quality of life for residents, learn 3 ways to increase staff empowerment, and learn how to remove roadblocks to staff empowerment. In the Teamwork and Communication module, we will describe why practicing communication skills optimizes resident safety, describe effective communication and teamwork both among team members and between staff, residents, and family members, list barriers to effective teamwork and communication, and explain solutions to the barriers using communication tools. In the Resident and Family Engagement module, we will define resident-centered care, explain the importance of engaging residents and family members, distinguish between different methods of engaging residents and family members, and discuss how to work with resident advisors, advocates, and long-term care ombudsman programs. Finally, in the Sustainability module, we will define sustainability and understand the importance of maintaining positive change, understand the link between sustainability and spread, learn how to create and implement a plan for sustainability. This includes identifying barriers to sustainability, developing solutions, and measuring it, and learn from examples of sustainability success across multiple settings. There are many ways to use the LTC Safety Toolkit. Users can share videos with teams to spark engagement and learning, provide templates and discussion guides to project leads, educate teams on teams, orient new staff, train teams to use teamwork and communication tools, and engage senior leaders and project champions. Each module in the LTC Safety Toolkit includes short videos, which can be powerful ways to spark the engagement of frontline providers. In addition, the toolkit can enable teams to address root causes of adverse events more effectively. The Teamwork and Communication module also contains useful, structured communication tools, including resources from Team Steps. These resources will help teams prevent misunderstandings and improve communication, the most significant contributing factor to prevent harm or errors in care. Tools such as the Staff Safety Assessment can be particularly effective in engaging senior leaders by demonstrating the need for their involvement in safety improvements. Users may encounter challenges when making use of the toolkit, such as engaging the interest and participation of senior leaders, contending with high staff turnover, and ensuring staff empowerment. The toolkit will help you and your facility work through these challenges, allowing for change and resident safety initiatives. If teams experience fatigue with improvement projects, team leaders should remember to streamline those initiatives and discuss them as managing change. For example, Kotter's 8 Steps of Change describes what happens to get change to occur. Step 1. Create a sense of urgency. Step 2. Create a guiding coalition. Step 3. Develop a shared vision. Step 4. Communicate the vision. Step 5. Empower others to act. Step 6. Generate short-term wins. Step 7. Consolidate gains and produce more change. And Step 8. Anchor new approaches in culture. Each of these steps is crucial to the success of culture improvement efforts, but real, lasting change happens one facility at a time. Improving culture requires an understanding that culture is different from facility to facility. Each facility must work to reform their own culture, and it must be owned by everyone. Another key element to create a culture of safety is explained in the principles of just culture. The term just culture refers to a system of shared accountability in which healthcare organizations are accountable for the practices they've designed and for sustaining the safe choices they've made. Staff, in turn, are accountable for the quality of the choices they make to ensure their residents receive the highest quality of care possible. A just culture environment reviews both the way the system is designed and an employee's choice of behavior in response to their assigned duties. It investigates events or safety concerns and determines an appropriate course of action with the employees involved. Just culture principles are crucial to the shared accountability necessary for resident safety and quality improvement programs to be successful. David Marks developed the Just Culture framework based on risk management concepts from high-reliability industries such as aviation and nuclear energy. A Just Culture system holds itself accountable, holds staff members accountable, and has staff members who hold themselves accountable. In a just culture, shared responsibility is the norm, and a commitment to eliminating the possibility of error is widespread. We're now going to watch a brief video from K. Scott Griffiths, who introduces just culture and how it relates to our work.
Hi, I'm Scott Griffith, the Chief Operating Officer of Outcome Engineering, and I'd like to take a moment to talk about just culture and what it means for a healthcare institution. The term just culture refers to a value-supportive system of accountability where healthcare institutions are accountable for the systems they design, and in turn, staff, patients, and visitors are accountable for the choices they make within those systems. In a just culture organization, there are 3 categories of behaviors that we must expect and learn how to manage. The first category is human error. We must predict that humans will make mistakes and occasionally drift into risky places. We define human error as the inadvertent action, inadvertently doing other than what should have been done. The psychologist will call it a slip, a lapse, or a mistake. But for our purposes, the only thing that's important is the understanding that it's an inadvertent action, doing other than what was intended. The second category of behaviors is called at-risk behavior. At-risk behaviors are, by contrast, choices. These are not inadvertent actions. An at-risk behavior is defined as the choice that increases risk where risk is either not recognized or mistakenly believed to be justified. And finally, the third category of behavior is called reckless behavior. Again, reckless behavior is a choice, much like at-risk behavior, but the distinction here is that the reckless choice is a conscious disregard of substantial and unjustifiable risk. Now, for a just culture organization, Recognizing that each of these three behaviors should elicit a different response is very important. Our response to the human who makes a mistake, or human error, is to console the individual and then examine the system around them. Oftentimes, human errors are contributed to or caused by risky system designs. That is, a system that might be pushing in an individual to make these types of mistakes. In addition to systems, we often see that human errors are caused by risky choices. A clear example of that is running a stop sign. If I come in and say that I ran the stop sign this morning on my way to work, the obvious next question is, what were you doing? How did it happen? Well, I might be just driving along and having a lapse in my mental state, which could cause me to run the stop sign. Or, by contrast, I could be doing something risky, like talking on the cell phone or even text messaging, which you would say increases the likelihood of me one day running the stop sign. Again, human errors are caused by both risky systems and by the choices that we make that increase the likelihood that one day we will make a human error. Our response to the human is to console them and to examine the choices and the system around them. At-risk behavior is the most important category of behavior because, quite frankly, at-risk behaviors happen more frequently. Humans will make mistakes, but more frequently, humans will make risky choices that usually result in positive outcomes. So when we see an at-risk behavior, the challenge is to examine how the individual believed the risk was worth taking and coach them around the choice to engage in the at-risk behavior. At-risk behaviors on the road are very common. You look around you and you see people text messaging, driving with one hand on the steering wheel, eating, or otherwise distracted as we drive down the road. These are behaviors that are common to most people, and usually when we engage in at-risk behaviors, we see positive outcomes, which often leads us to learn the wrong lesson from this risk-taking behavior. In a just culture organization, we coach the individual and we examine the system around the individual. We look to what the incentives might have been for the risk-taking behavior. If possible, we try to remove those incentives and create positive incentives for healthful behaviors. Systems and behaviors go hand in hand, and we must examine the choices and the system around the individual who engages in an at-risk behavioral choice. And finally, the reckless behavior is the choice to consciously disregard a substantial and unjustifiable risk. You might think of intoxicated driving on the road. In those situations, our response is to punish the individual to send a punitive deterrent signal to those engaged in the behavior. We have to go back and at times look at the system to understand the resiliency involved, but most of our response is tied to the punitive deterrent of punishment. Establishing where the line is drawn between at-risk behavior and reckless behavior is the most critical thing an individual or organization can do around a particular risk. This is often challenging, but it can be done with the collaborative effort of the employees and the leadership alike.
Just culture helps us understand risk and human behavior. There is a range of possible attitudes and behaviors related to risk, and they can be described in 3 categories. Human error, inadvertently completing the wrong action, a slip, a lapse, or mistake. At-risk behavior, choosing to behave in a way that increases risk where risk is not recognized or is mistakenly believed to be justified. And reckless behavior, choosing to consciously disregard a substantial and unjustifiable risk. To improve outcomes, human error, at-risk behavior, and reckless behavior should each be managed differently. Human error is a product of both system design and behavioral choices. Human error can be managed through changes in processes, procedures, training, system design, or work environment. The proper management approach is to console team members who have committed a human error and to ensure proper systems and procedures are in place to support future appropriate choices. At-risk behavior is an active choice to engage in risky activity through a belief that the risk was either insignificant or justified for a particular outcome. The best approach to deal with at-risk behavior is to remove any incentives for engaging in it, confirm that the system encourages healthy, risk-reducing behaviors, and coach team members to know what is going on around them. And reckless behavior is a conscious disregard of substantial and unjustifiable risk. When reckless behavior has occurred, it must be met with remedial or punitive action to decrease or eliminate the chances the behavior will recur. A just culture environment is ruled by both transparency and accountability. In a punitive culture that does not strive to understand underlying reasons for at-risk behaviors, transparency is impossible. This is especially difficult given that transparency and open communication are necessary for true cooperation, coordination, and teamwork to occur. Transparency is also important in addressing system factors that may contribute to harm. At the other extreme, a culture that does not hold team members accountable will never achieve optimal outcomes. In what has been known as a blame-free culture, there is a general failure to uphold standards of care, and staff members are less likely to hold themselves and one another accountable for appropriate behaviors. Overall, a just culture environment will support improved outcomes by emphasizing both robust systems and appropriate behaviors. There are key ways leaders can apply just culture principles to enhance culture, accountability, and safety in their facility. First, facility leaders can have procedures in place for employees to follow. Confirming that protocols are standardized and well communicated helps employees make the right choices, leading to the best outcomes. When designing procedures, be sure to eliminate reasons for at-risk behavior and reinforce incentives for healthy, risk-reducing choices. Second, ensure employees are properly trained. Employees should know the correct procedures and understand the reasoning behind those procedures so they will be more inclined to engage in appropriate behaviors. Third, offer positive reinforcement at monthly meetings. These meetings are an opportunity to reinforce learning systems that contribute to improved results. We've covered just culture, which has to do with creating a safe environment for staff to share their safety concerns. Together, staff and leadership must work toward building safety and quality into the system. That is how and why we do this work.
That sounds great, but the reality is we're so busy here day to day that I don't see how we can add something else on top of what we're already trying to get done.
By preventing our residents from getting infections, becoming unstable, and then needing to be transferred to the hospital, we're going to reduce everyone's workload. Nikki, you know how busy your shift is when residents are unstable. We're going to change how we do things, not necessarily add more to do. The goal is to build safety into our system. Safety and quality is how you do what you do, the processes we put in place to provide care. So we need to assess if changes to workflow and practice benefit residents and what changes work best. And we all need to work together to figure that out.
Cotter's 8 steps of change and just culture are only 2 components for implementing change in your facility. The LTC Safety Toolkit incorporates these principles as well as a number of other quality and safety tools, including Team Steps, 6 Sigma, Institute for Healthcare Improvement's Model for Improvement, Plan, Do, Study Act, Root Cause Analysis, and Failure Mode Effect Analysis. In addition to these tools, a number of LTC-specific resources offer excellent examples and support for improving resident safety at your facility. The Advancing Excellence in America's Nursing Homes campaign and the Centers for Disease Control and Prevention's Infection Prevention website for long-term care facilities are just 2 of these examples.